Hello. Hi, good afternoon. So thank you everyone for coming here today to actually learn more about patient empowerment in diabetes care. Because we know that now diabetes is a very big problem worldwide, right? We know that the number of patients with diabetes is increasing. All right, so the number of people with diabetes definitely is increasing worldwide. In 2000, actually, there were about 151 million people with diabetes, but this number has been increasing year on year. By 2011, there were 366 million people with diabetes, and this number is projected to increase further to 552 million by the year 2030, which is indeed very alarming. How about Malaysia, you ask, right? So we have actually a study done by the Ministry of Health, which is the National Health and Mobility Survey. This actually found that there's an estimated 3.9 million adults in Malaysia aged 18 and above who had diabetes as of last year. This is definitely higher than the figure in 2015, which was 3.5 million. So if you take 5 adults in Malaysia, 1 out of 5 actually have diabetes, and this is really alarming. And what's worse is that half of these people with diabetes have never been examined for or diagnosed with diabetes. And if we want to look at the prevalence of diabetes in Malaysia with regards to states, you can see that actually Negeri Sembilan, Perlis, and Pahang have the highest prevalence of diabetes. Yeah, the home state of Alpro Pharmacy in Negeri Sembilan. Yeah, 33.2, one third of adults having diabetes. That is not a good figure indeed. So let us learn a bit about diabetes, because I'm sure you want to know what are the early signs of diabetes, right? It is important to detect diabetes early because it is important to be able to treat it early. So what are some of the early signs of diabetes, you may ask? Among the common diabetes symptoms would be blurred vision, feeling hungry all the time. Some people will say that they feel thirsty and have to drink a lot of water. And then they have to go to the toilet very often in the day as well as the night. And then despite eating a lot, feeling hungry, these people are also losing weight. And some of these people will feel very tired and weak. Another symptom that some people will say is that they have numbness or tingling, an abnormal sensation in their hands or feet. And also, people with diabetes have poor wound healing, and they are also prone to having infections, be it wounds on the skin or having urinary tract infections, for example. And if severe enough, they can feel having the symptoms of feeling nauseous and also vomiting as well. Now, what are the risk factors that are common that will predispose someone to having diabetes? So there are some risk factors that are modifiable, meaning we can do something about it. And there are also some risk factors that are non-modifiable, means that we can't really change it that much. For example, you can't change who your father or mother is, right? Because family history actually plays a role in determining a person's risk of diabetes. Age is also an important factor because with increasing age, there's an increasing number of people with diabetes. But there are also things that you can change. So all hope is not lost, you see. Uh, if you lead an inactive lifestyle, that is actually a risk factor. So one thing you can do is probably to lead a more active lifestyle, do some changes in your diet. For example, if you are overweight or obese, you can actually try to reduce your weight. Okay, and of course, diabetes by itself confers already a risk for you to have other health problems. But if you also have high blood pressure, high cholesterol, you are even at higher risk. Yeah, and of course, ladies who have had a history of what we call gestational diabetes or high glucose levels in pregnancy, they tend to have a higher chance of having diabetes on in later life as well. And of course, having what we call impaired glucose tolerance or impaired fasting glucose is already a pre-diabetic state, which would actually lead to a higher risk of developing full-blown diabetes. Now, moving on to the next slide, there have been studies that have shown that it is very important to detect diabetes early. Now, one of the reasons is, of course, so that patients can begin to manage the disease early. Because if you can manage the disease early, you can try to potentially prevent or delay serious complications that can decrease the quality of life. For example, this study in Europe which was conducted a number of years back, actually found that if screening and treatment was implemented without delay for patients with diabetes, the percentage of people suffering from either a stroke or requiring a heart bypass surgery was significantly reduced. So in this study, if screening and treatment was implemented very fast without delay after diagnosis of diabetes, then only 18.4% of people suffered a stroke or required a bypass 10 years after diagnosis. But if there was a 3-year delay in the diagnosis of diabetes, this figure increased to 22.4%. And if there was a 6-year delay in diagnosis, this figure increased further to 25.9%. So let us find out what are the common complications a person may develop as a result of diabetes. So diabetes by itself is not a painful disease. So people don't always feel problems when they start having diabetes. But we want to prevent complications because complications later on are what ultimately causes trouble to the patient in terms of reducing quality of life and even reducing the number of years of life. So diabetes complications that are macrovascular in nature, meaning that medium or large blood vessels are affected because of diabetes, can lead to conditions such as stroke, heart attack, or reduced blood circulation to the peripheries or the limbs. So we all know, of course, that stroke is definitely a big problem, can lead to major disability. Heart attack is one of the major killers of people in this country. And reduced blood circulation leading to reduced blood flow to, for example, to the legs may lead to gangrene, which is tissue death due to the loss of blood supply. And this can lead to limb amputation. So there are a lot of people who have had either toes or feet or even up to the level of the knee. They've got amputations because of wounds that don't heal well. The leg gets infected and then they need to get an operation done. And this definitely will impair the quality of life. Besides that, there are also microvascular complications, meaning complications that affect the smaller blood vessels to the body. So this can lead to problems like kidney disease, which is termed nephropathy, which ultimately can lead to a person requiring dialysis or renal replacement therapy. And of course, there can be issues with nerve problems leading to neuropathy. People can get pain, tingling sensation in the fingers and toes, and also retinopathy, which is problems at the back of the eye, which can lead to blurring of vision and ultimately blindness. And there's also one problem that many men are afraid to admit to their doctors, that they have erectile dysfunction or difficulty performing during sexual intercourse. And this, of course, will impact quality of life as well. So we are going to move on to lifestyle and diet changes. Yeah, so a lot of people do ask this question, Kaija. I'm sure you've got this question as well. Can we reverse diabetes with lifestyle and diet changes? So, well, I'd just like to give a bit of background to why people are talking about this. Can I have the next slide? There have been various studies conducted around the world. For example, China, Finland, Japan, India, and even America, where they actually found that people with pre-diabetes or levels of blood glucose that haven't reached the level of diagnosis of diabetes, if they actually put them through a very intensive lifestyle intervention, meaning they go through very intensive lifestyle changes in terms of diet and exercise, there is a very high chance that they can actually prevent the progression to diabetes. So for example, I can share with you about the United States Diabetes Prevention Program. They actually took people who were pre-diabetic. They actually look at them, they put them into 3 different groups. One of them was just the standard advice that you may get, like for example, give you just general advice on diet and lifestyle. Another group, 1/3 of them were started on medications, metformin. And another group actually were put into a very intensive program where they had life coaches, they had people to really call them up, make sure that they're doing intensive exercise, at least 150 minutes a week of moderate intensity exercise, as well as diet advice, and then group sessions over a period of months. And they actually all consistently lost a significant amount of weight. This group with the intensive lifestyle intervention was the group with the best outcome in terms of prevention of diabetes, up to 58%. So when we try to answer this question, can we reverse diabetes? Now, it also depends very much on the severity of the blood glucose level when you are first diagnosed with diabetes, how early on or late on you are in the diagnosis and whether you have already developed complications. But I would say that it is possible to a certain degree to reduce the diabetes medications gradually, but this must be done very closely supervised by your doctor and with consistent monitoring. Yeah, I don't advise anyone to just suddenly stop all your medications just because you feel that you are doing a lot of work in terms of diet and exercise, because there is also a limit to what these interventions can do, and it also depends very much on your current blood glucose levels. This needs to come along with lifestyle and diet changes for sure. Next. So for people with obesity or people who are overweight and who also have diabetes, one realistic goal to achieve within, for example, the first 6 months of diagnosis is to try to lose about 5 to 10% of your initial body weight. This has been proven to be able to help with the control of blood glucose. And how do you do that? Of course, working closely with someone like Kaija, a trained professional, will be able to help you achieve your weight goals and better control your glucose readings. We also, in the field of endocrinology, have medications that are also effective in terms of weight loss. Now, in terms of lifestyle modification, of course, diet is one, and physical activity is also crucial. So the recommendations that we have are to actually do at least 150 minutes a week of moderate intensity exercise. So what we mean by that is that activities, for example, like brisk walking, something that will actually make you sweat a bit, keep your heart rate a bit faster than usual, yeah, make you feel a bit breathless. But one thing to be very careful about is if you have never done exercise in your life, don't suddenly go and run a marathon. Yeah, because there can be complications. For example, if there's already some underlying heart disease, you may actually get problems because of that. So before any vigorous activity, you should actually consult a doctor to get complications assessment done, meaning to make sure that you are fit enough to do the exercise before you actually embark on your program. So it's a good tip to start very slowly, low intensity, and gradually work your way up. So in terms of exercise also, it's recommended to not go more than 2 consecutive days without exercise. Try to do it at least about 5 days a week. And this will help to improve glucose control and maintain weight and ultimately reduce complications in terms of your cardiovascular complications like heart disease, stroke, etc. So we know self-monitoring of blood glucose is very important. Yeah. Now, why is it important? Because you can get immediate feedback and data, and this can actually help people with diabetes to assess how various factors affect their blood glucose control. For example, the choice of food that they make, what type of physical activity and the level of physical activity that they engage in, and also the medications that they're on. How do these factors affect their blood glucose? So this can actually help people with diabetes to evaluate their current management efforts, their current regimen. So this can either help to reinforce what they're already doing, or this can actually help them to realize that what they're doing is not right for now. It calls into question their choices in terms of lifestyle. For example, if they take certain type of food, they take certain type of drink, this type of cake, this type of durian, for example, what does it do to the blood glucose? Yeah, and if they exercise, how does it help? And also the doses of medication they're on. So why do we need to do? Now, in terms of self-monitoring of blood glucose, there are skills that people need to know and have. So there's the operational skill and there's also the interpretive skill. So what does this mean? Operational skill means that the patient knows how to do the blood glucose monitoring. So they know how to select the meter, make sure that the meter is accurate, that the readings that they get are accurate, and also how to document the data. But if they know how to operate and yet they don't know how to interpret or use the data properly, then it's not going to be very useful. I also have patients who are very diligent, very hardworking. They will keep very good diaries. They do the monitoring 4 times a day. They have very complete readings, but yet they did not do anything with it. The blood glucose is still very high, for example, and they did not adjust their doses of medications, for example, insulin, and it didn't help them actually. So it's good to actually advise or educate patients on the interpretation as well. So a good start would be to know what are the targets for the blood glucose level. Or for example, what level they should be at the fasting or after eating, 2 hours after eating, for example. Everyone has individual targets. Yeah. For example, someone who is newly diagnosed with diabetes, their sugars are very high, for example, 20, 30. We won't expect them to reach normal levels immediately when we start medication because they may feel very uncomfortable. They may get symptoms suggestive of hypoglycemia. So we want them to work hand in hand with them to get their blood glucose levels down safely and reasonably fast to a certain target, but not excessively fast as well. And we also want to teach them about hypoglycemia. What are levels that are too low, for example, and help them to address those issues to prevent further episodes of hypoglycemia and know how to treat as well. This pattern management will be able to use to help patients to decide what to do, especially patients who are on insulin, whether they need to adjust their doses higher or lower, yeah, and when to seek advice as well. Because if the patient is still having poorly controlled blood glucose, it may be time to seek help from a healthcare professional to help to adjust the medications or give further advice. Appropriate frequency and timing also is also individualized. When to do the blood glucose monitoring and how many times to do will be individualized for the patient. So just an introduction to blood glucose and this term called HbA1c. This is very important in terms of monitoring the condition or monitoring the level of diabetes control. So when put it simply, if we just say a blood glucose level, say a finger stick blood glucose level, the level that you get when you prick your finger and put it at the meter, this is a blood glucose reading that gives the at the moment level or the current level of blood glucose in your blood. So this can change throughout the course of the day, from morning to night, before meal, after meal. It can change very quickly and very drastically as well. But this level, that this test that is called HbA1c, which you normally do in hospital setting, but sometimes there are also this point of care testing where you get the meter as well. This is a glycosylated hemoglobin, meaning it is something that actually reflects the average blood glucose control over the past 3 months. And this is useful to track diabetes control over a longer period of time. Now, this is the test where patients can't trick or cheat the doctor. Because the blood glucose where you do the blood test or you prick your finger, that one can be can be faked to a certain degree. It can be adjusted basically. For example, if you have not been taking care of your blood glucose and you just tomorrow you're going to see the doctor, then you just fast that whole day, don't take anything, and then the next day you go to see the doctor, you may get a artificially good kind of blood glucose level for that day, for that time. But this HbA1c will be able to tell the whole story. It reflects the past 3 months of control, and this is a level you can't actually deny. And it's very useful to help us to track the progress of the patient after starting patients on treatment, whether they're getting better or not. Yeah. Having said that, there are also some factors that may influence or impact the interpretation of this test, but this is something that can be discussed with your doctor. Okay, so generally we do have targets as for everything like blood pressure, lipid levels, and even blood glucose. So as I mentioned before, target blood glucose levels are actually individualized. But generally speaking, for the general population, there are some general targets that we can try to achieve. So these are the levels that we have in our very own Malaysian clinical practice guideline for diabetes, where the level of fasting or pre-meal blood glucose should be in the range of 4.4 to 7 millimoles per liter, which is what the number you get on your meter or on the blood test that you do in hospital. If it is a non-fasting or 2 hour after eating, postprandial, which is after eating, then we should aim not to be higher than 8.5. In terms of the HbA1c, the test that I mentioned just now, we can also use it to diagnose diabetes now and also use it as a marker of monitoring of the glucose level. A level of 6.3 and above would be diagnostic of diabetes. And if it is between 5.6 to 6.2%, it is actually considered pre-diabetes. And a normal level would be less than 5.6%. So Kaija, do you have anything that you'd like to share with the people today?
Yes,
Yeah,
actually, doctor, you were actually mentioning about SMBG, right? So actually, I have a little bit of insights on this because as everyone know, I would say diabetic
yeah,
is a disease that actually have direct. I would call it direct is the word direct direct influence on food
yeah,
and the disease. Here you eat, there your glucose
Yeah.
go up. Here you eat, there the glucose go down. So it's an immediate effect. Do you agree with me, doctor?
Yes. Yes, there is. Yeah.
Right? So I would actually really, really strongly emphasize on this that everyone, you all should do the SMBGs. We call it self-monitoring, okay?
Self monitoring
S
blood glucose.
So thank you for correcting me, doctor. So self-regulating blood glucose. So you have to check it actually because you see, like for example, when it's durian season, you
Oh,
love durian, but can you take it? That's the question. If someone said no, you cannot take durian, so you're gonna stop taking that? Not at all, not even one. Satu ulas pun tak boleh. That sounds very sad, right? So
is that, yeah, if you love durians, yeah. Mm.
Mm. So how about you can take one, then after 2 hours you can actually check your glucose and see how's it doing. So if it's a bit higher or a bit lower, then you will adjust your food
Yeah.
accordingly.
You can take
Okay, so
smaller portions. Yeah.
yes, smaller portions. Mooncake festival is coming soon.
Oh, yeah.
Take the whole mooncake one off? Definitely not. You can enjoy, but in a moderation way, and remember to check your glucose reading, right?
Yeah. And
Okay.
for experienced insulin users also, this can also help you to titrate the dose of insulin that you're taking because you can actually tailor the dose based on the content of the carbohydrate that you are taking as well. Mm.
Yes, so we have to actually, from our side, I mean, when the patients with type 1, they will come to us, we will actually educate them on like what is one serving of carbohydrate. Then from
Right.
there, we'll look into every 15 gram of carbohydrate. Then we will tailor it to the insulin. So we can work hand in hand. So we can help our patients to actually control the glucose, control the food. At the same time, please remember to check your glucose level, right?
Yes, definitely.
Mm. So I would like to do a little bit of advertisement time here. So as you all know, maybe some of y'all are new here, so y'all might not know what is Sugo 365 is all about. So it's
Mm.
actually like what I said, it covers the SMBG part. So you actually get very reasonable price of strips. At the
Mm.
same time, you get live chat, you get helps from NND. So which is what stands for NND is nutritionist and dietitian. We will be there to assist you in terms of your food. Like I said, it's immediate result. So it's nice to have someone there, So like for example, tonight I'm going for Korean. So what is the food I should choose?
Mm.
Things like that. What is the food I should avoid? How much should I take? So that is where we will come in. But of course, even with dietitians, never miss your appointments with your doctor, right? Doctor's appointments are important. And
Yeah.
all these records that you're gonna have here is gonna be synced. Now we are on digitalization. It's a digital world. Come on, man. So you are gonna have to sync the meter with your phone. It's gonna be an app. So that you can show the app to your doctor, and doctor will actually see the pattern, right? Then from there they will make their decision. That will be very helpful for doctors to make decision. Am I right, doctor?
That's very good because one problem my patients have is the price of the test strips. Yeah,
Ah,
they really want to do the testing, but one of the problem that stops them is the price, the cost. So it would be good if there is a program that can help them to save and minimize the cost for this. And having the added benefit of having someone who can actually guide you in terms of the nutrition and diet advice is actually really helpful.
yeah, yeah, yeah. I actually have a few customer with me, our subscribers. They actually tell me that it's very nice that the machine the app they actually do a summarize, or you can call it analysis, to tell you like, oh, for the past 1 month, how many hypers, how many hypos that you have. That will
Hmm.
be very beneficial for a doctor. Am I right? So doctor will get a trend, which is
Yeah,
somehow what he said, trend to adjust insulin and medication,
that will
right?
be good to us to help the patient to tailor their insulin regimen and the
Yeah,
medications.
yeah, and remember, no one medication that actually suits all. Different medication suitable for different people. Doctor needs the data to actually make better judgment,
That's right.
right?
Well, I would say that it's very important if you have any symptoms or you have a fear that you have diabetes, please go and get yourself checked because early detection is critical. And make sure that patients who need to do so, please make sure you do your self monitoring of blood glucose as requested or planned by your doctor. It's very important to make sure that you actually keep to this regimen and also help you to adjust the medications and get feedback on terms of your lifestyle choices and the impact on blood glucose levels.
Okay, that is very, very important. And thank you very much, doctor, for the take home message. I'm sure everyone will keep that in mind. Okay,
Yeah,
so for all our friends that have actually followed us throughout that 1 hour, please, I thank you for your time. And please stay tuned at our Facebook page, which is SUGO 365. Please stay tuned at our Facebook page for more events about diabetic care, informations, anything about diabetic care. You can also PM us for more inquiry. And just to let you know again that Sugo 365 do provide very good packages for you all. We have health professionals here to support and we provide very good packages. All right.
yeah,
And if you are facing any problems, you can also, if you wish to have a face-to-face thing, you can drop by to any Alpro pharmacy because we in all outlets we do have nutritionists and dietitians there to help you, and we are always here to assist. We shall see y'all in the next session. Thank you very
oh,
much, Dr. Choy. We see y'all. Thank
thank
you.
you. Bye.